Hi, everyone. Thanks for joining. We're going to walk through our clinical medicine highlights for the second quarter of 2021.
Hi, everyone. This is Jenny Wu presenting some recently published medical titles in the clinical space for Q1. For the first title, we have the Atlas of Anatomy of the Peripheral Nerves. This is a full color expert edition. The other edition that was released was a student edition. So this one is definitely dedicated to professionals. It focuses on the anatomy of the peripheral nervous system, and it features 500 outstanding color pictures and over 100 top quality 3D videos. It also offers a unique 3D topical graphical guide to the anatomy of the peripheral nerves and provides a unique resource for anesthesiologists, radiologists, orthopedic surgeons, neurosurgeons, and rheumatologists, and many of the other healthcare professionals that are allied to the field. The next title we have is the Emergency Medical Responder. So this book has certainly played a very important role in the pandemic, just as EMTs have played a very important role. So this is Springer's first clinical medicine publication specifically on EMT work, and it will publish at a critical time. This resource for emergency medical responders addresses key issues that are faced by those in the field, which is especially important given the response procedures that are needed during the pandemic. It goes far beyond COVID-19 protocols and also serves as an important guide for any EMS or EMR provider. This is the only reference guide in the field, and it has been thoroughly revised, and it's now second edition. This is also the first book in a new informal initiative to bolster the Springer EMS, EMR titles. The next book we have here, Clinical Pathways in Stroke Rehabilitation. This is an open access book that focuses on practical clinical problems that are frequently encountered in stroke rehabilitation. It provides evidence-based clinical practice guidelines for stroke rehabilitation, and it discusses clinical problems and evidence, comments on assessment, therapy, and technical aids. This book is a World Federation of Neurorehabilitation educational initiative. It will bridge the gap between the rapidly expanding clinical research in stroke rehab and clinical practice across societies and contents. The last book on the slide is Developing and Utilizing Digital Technologies in Healthcare for Assessment and Monitoring. The use of health interventions in healthcare has increased rapidly in recent years. This is partly due to the rise in technical gadgets and applications used in daily routines. Our Fitbit, thinking of that, or any other technical gadget is one to think about and consider when you think about these types of technological innovations. So what makes these digital devices unique is that now patients can be monitored and their condition managed in a remote way. The next set of titles that we have for the list is of Q1 recent releases is the Pictorial Treatise on Gallbladder Cancer. This book compiles information based on departmental experience of more than 1,000, including 600 resection cases. It's an authoritative work that provides detailed insights into various aspects of gallbladder cancer and its management. It will be a valuable resource for physicians in high incidence areas, but also for low incidence areas alike too. It is richly illustrated throughout with radiographs and operative and specimen photos, very important. And the next title is Advances in Specialist Hip Surgery. This book describes current and emerging techniques in hip surgery, providing the essential up-to-date knowledge for orthopedic surgeons who plan to become specialist hip surgeons. The international author team consists of recognized leaders in the field, many of whom have developed the described classification and new surgical techniques. And the last title we have in our Q1 2021 medical highlights is Basic Open Rhinoplasty. This is much closer to a textbook concept rather than a professional book, but also very extreme practical. It's conceived for young surgeons, and it is authored by someone who is highly experienced and dedicated to teaching. So instead of the usual classifications of surgical techniques and anatomical regions, here the book has a learning process that is based on a sequence of steps that are explained in a very thorough didactic style. Now over to the Q2 title highlights. We will kick it off with anesthesiology, and Victoria will present those titles.
Hi, everyone. So this first title is the textbook of oncoanesthesiology. So this book covers all essential evidence of perioperative care and anesthetic concerns for cancer surgeries, including the evaluation and assessment of patient schedules for cancer surgeries, perioperative anesthetic management of various cancers, perioperative analgesia for cancer surgeries, and issues related to inoperable cancers. It reviews anesthetic considerations for all cancer types, as there is a wide variation in anesthetic requirements in the subset of patients. This book fills the gap in the current texts that do not exclusively cover anesthesia for cancer surgeries and serves as a comprehensive but quick guide for trainee residents and fellows and practicing anesthesiologists, clinicians, and surgeons. So, anesthesia for uncommon and emerging procedures provides detailed and practical information for anesthesia providers who are challenged with providing anesthesia for both emerging and infrequently performed procedures. A concise and stepwise approach in this book provides accurate and up-to-date information that helps the reader to safely treat patients in procedures such as conjoined twin separation, pediatric heart and lung transplantation, pancreas and small intestine transplantation, and many other complex surgeries and procedures. This book fills a unique void long felt by anesthesia providers and is a must for in every department or library, as it provides handy references even for providers engaged in providing anesthesia for such procedures on a regular basis. Anesthesiologists and those in pre-operative clinics, such as hospitals and APRN or PA providers, will find this book to be an invaluable resource for optimizing outcomes in anesthesia. And the next one is Questions and Answers in Pain Medicine, a Guide to Board Exams. This book provides a practical and comprehensive review of pain medicine in a clear and easy to apply question and answer format. Divided by topic, this book includes Q&As on pain basics, common pain syndromes, medications, pain management in special populations, and interventional pain. It is intended as a guide for residents and fellows and is written in such a manner to provide instantaneous feedback on correct answer choice and explanations for self-evaluation while preparing for written board examinations. This book fulfills the need for a resource that is similar to the Accreditation Council for Graduate Medical Examination board examination in the US, as well as international equivalents. So the next topic will be veterinary medicine, and this is a really unique title that we have. Cannabis therapy in veterinary medicine provides in-depth information on the applications of cannabis products as a legitimate medicine that can treat a variety of diseases and disorders in domestic animals. Cannabis as a therapeutic in veterinary medicine is gaining interest among owners and practitioners as it reviews development and testing of cannabis-based medical products and introduces the nutritional components of cannabis plants. This seminal text serves as a go-to resource for veterinary practitioners on cannabinoid therapy. It will also serve as the foundation for clinicians and researchers interested in this emerging field of veterinary medicine.
Selective decontamination of the digestive tract. Current guidelines explains the basic concepts of selective decontamination of the digestive tract, also known as SDD, to help those involved in treating critically ill patients improve outcomes and the quality of care. SDD is used in intensive care units to reduce the occurrence of infections in critically ill people through the administration of antibiotics that target both normal and abnormal flora to reduce bacteria and fungi in the digestive tract and prevent them from causing illness in high-risk patients. SDD has led to major changes in our treatment and prevention of infections over the past 40 years. It is the most studied intervention in intensive care medicine and the subject of 73 randomized controlled trials, including 15,000 patients and 15 meta-analyses. SDD reduces morbidity and mortality, is cost-effective and safe, and it does not increase antimicrobial resistance. The book includes detailed step-by-step explanations of this treatment and its components alongside flowcharts and case studies. It will be a helpful guide for a broad audience that includes intensivists, critical care practitioners, junior doctors, microbiologists, ICU nurses, as well as infection control specialists and pharmacists. Oh, and for those that I didn't mention, but we've now moved on to critical care and emergency medicine beyond veterinary care. Should have noted that first. The next title I'm going to present is Social Emergency Medicine Principles and Practice. It's written by a prominent U.S. author team and explores the interplay of social forces and the emergency care system as they influence the well-being of individual patients and the broader community. Too often, typical protocols such as prescription and follow-up visits are simply not enough to ensure wellness. Basic social needs, including housing, safety, transportation, economic opportunity, food security, and nutrition, are critical to recovery and health. This book aims to fill a gap where there is a great need for information and resource to assess and assist emergency department patients with social needs. Violence and substance abuse are covered uniquely through the lens of social emergency medicine. Case studies help illustrate how small changes can reduce bias and improve care and outcomes. Each chapter provides background and research, implications, and recommendations for practice from the bedside to the healthcare system and beyond. This is an essential resource for physicians, physicians' assistants, residents, medical students, nurses, nurse practitioners, social workers, hospital administrators, and other healthcare professionals who recognize that high-quality emergency care extends beyond the ambulance bay. Decision-making in emergency medicine, bias, errors, and solutions covers various scenarios when errors, bias, and systemic barriers hinder emergency medical care. It discusses the impact of such scenarios and offers solutions to mitigate their undesired outcomes. The process of clinical reasoning in emergency medicine is a complex exercise in cognition, judgment, and problem solving. Written by a team of emergency specialists, this is an invaluable training resource for new and experienced emergency care providers alike. The book directly addresses 51 different types of biases and errors supported by 4 case examples each, and offers concrete tools to enhance clinical competence and mitigate mistakes, which in turn reduces morbidity and mortality statistics. And now we're moving on to endocrinology. Practical clinical endocrinology covers the whole scope of clinical endocrinology, including both common and rare diseases, with an emphasis on practical clinical management. Each topic presented begins with the presentation of a typical clinical case, and then the topic is approached in a question and answer format linked to the clinical case presented, highlighting the most important questions in diagnosis, differential diagnosis, and therapy. Numerous figures and tables are included to help understanding. The book is intended for doctors in training and particularly useful in preparation for board exams. However, established clinicians looking to broaden or refresh their skills may also find it extremely helpful.
Oh, Jenny, I think you're muted.
Hi, everyone. So moving into books on internal medicine, the first book is Chronicity. This book comprehensively and critically discusses chronicity as a crucial challenge for the future of medicine in an era of aging populations and the steady growth of non-communicable comorbidities. It describes how health systems that are still designed and based on treatment of acute diseases are suffering from crowded emergency rooms and growing conflicts between patients, while medical staff increasingly face frustration and the risk of burnout. Chronicity explores how primary care, incremental medicine, and initiative medicine can improve the care provided for patients with chronic conditions, uniquely reflecting lifelong clinical experience and stimulating discussion on a highly topical issue. This book appeals to a wide readership from professionals through caregivers to patients with chronic conditions. The next title we have is The Ultimate Medical School Rotation Guide. Written by the top medical students from Harvard, this book provides medical students with the often elusive information and skills required to ace their clinical rotations. Chapters cover all major medical subspecialties such as internal medicine, general surgery, cardiology, dermatology, orthopedics, neurosurgery, and ophthalmology. Additionally, the book offers many novel features, including a review of core rotation skills for oral presentations and a walkthrough of a day in the life of the medical student on a particular rotation. It focuses on the common cases that students actually encounter in the hospital. This format offers a complete and concise overview of all that is needed for each rotation, and the audience for this book is broad and includes all current and prospective medical students. Next title we have is the Physician's Guide to Diagnosis, Treatment, and Follow-up of Inherited Metabolic Diseases. This updated and expanded edition is a unique source of information on diagnosis, treatment, and follow-up of metabolic diseases. Metabolic diseases are diseases or disorders that disrupt normal metabolism, which is the process of converting food to energy on a cellular level. The clinical and laboratory data characteristics of rare metabolic conditions can be disorienting for clinicians and laboratory personnel alike. Often, reference laboratory data is scattered and the clinical descriptions can be obscure. The new physician's guide, with over 600 additional diseases featured, documents 1,200 conditions grouped according to the type of disorder, the organ systems affected, or phenotype. It includes relevant clinical findings and highlights the pathological values for diagnostic metabolites. Guidance on appropriate biochemical genetic testing is also provided, and established experimental therapeutic protocols are described as well. The authors are acknowledged experts, and the book is a valuable desk reference for all who have to work with inherited metabolic diseases. And then the next title we have is Telemedicine. So we all know telemedicine has experienced explosive growth and has become more important than ever. This book guides doctors and hospitals with a primer on requisite steps before embarking on telemedicine service development. It also covers how to implement a functional and efficient program to ensure quality of care in pulmonary, critical, and sleep medicine patients. All chapters are written by interprofessional authors that are leaders in the field of telemedicine with extensive knowledge of diverse telemedicine programs and robust real-world experience on the topic. This is an ideal guide for telehealth program managers and pulmonary, critical care, and sleep professionals interested in improving their telehealth practice. Okay, and
so some titles related to neurology and neurosurgery. The first one, Neuroimaging of COVID-19. So this book presents the variability of the effects of COVID-19 on the nervous system, with the purpose to update content and images based on improved scientific evidence. Current available data shows that involvement of the nervous system is frequent in patients with the coronavirus infection. The most common neurologic syndromes include cerebrovascular disorders, encephalopathies, inflammatory central nervous system syndromes, peripheral neurologic disorders, and psychiatric disorders. Considerations in this book highlight the urgent need to better clarify the neurotropic potential of the coronavirus. CT scan is useful to detect large hemorrhage of ischemic lesions that have been reported in COVID-19 patients, but lacks identifying other possible neurological complications, such as microhemorrhage or encephalitis. This book will be invaluable for neuroradiologists, radiologists, neurologists, and all physicians involved in the pandemic. Okay. Imaging dementia helps physicians choose from currently available imaging tools, promoting the correct and cost-saving diagnosis and management of common dementias. Magnetic resonance, or MR, and nuclear medicine techniques are routinely used to facilitate diagnosis, select therapies, provide information regarding the prognosis, and monitor therapy response in patients with cognitive impairment and dementia. The advent of quantitative MR techniques, such as diffusion-weighted imaging, perfusion imaging, etc., have opened up new opportunities to diagnose neurological diseases based on objective findings and offer unique new insights into the main neurodegenerative diseases of the human brain. To help remedy the situation, this book offers practical and useful algorithms and rules that can be directly applied to the clinical setting. It provides concise content together with a wealth of clinical case material. The title, written by two leaders in this field, provides concise contents together with a wealth of clinical case material, offering practical and useful algorithms and rules that can be directly applied in the clinical setting. So the next title, Clinical Neurotechnology Meets Artificial Intelligence. Neurotechnologies such as brain-computer interfaces, or BCIs, which allow technical devices to be used with the power of thought or concentration alone, are no longer a futuristic dream or, depending on the viewpoint, a nightmare. Moreover, the combination of neurotechnologies and AI raises a host of pressing problems. Now that these technologies are about to leave the laboratory and enter the real world, these problems and implications can and should be scrutinized. Clinical neurotechnology meets artificial intelligence brings together scholars from a wide range of academic disciplines, such as philosophy, law, the social sciences, and neurosciences, and is unique in terms of both its focus and its methods. Philosophical and legal analyses of normative problems are complemented by a thorough empirical assessment of how BCIs and other forms of neurotechnology are being implemented and what their measurable implications are. Clinicians, philosophers, lawyers, social scientists, and engineers will greatly benefit from the collection of articles compiled in this book, which will likely be a standard reference work on the philosophy of intelligent neurotechnologies. And the last one in this section, Neurocritical Care for Neurosurgeons, discusses the management of neurocritical care patients, including treatment indications, the physiopathology, and factors that affect outcomes in patients requiring neurocritical care assistance. Highlighting patient care in the intraoperative period, it addresses the need to improve continuing education in this area, and is the first book to provide a simplified overview for neurosurgeons and neurologists and understanding the UCI patient journey. Thanks to the accessible neurosurgical specific language, the book is well suited for all professionals involved in neurocritical care, including students, but is also a valuable resource for residents and researchers, as well as experienced neurosurgeons and neurologists looking for updated information and guidelines.
All right. Moving on to oncology. The Atlas of Liquid Biopsy, Circulating Tumor Cells and Other Rare Cells in Cancer Patients' Blood provides a wealth of images and extensive information on circulating tumor cells, or CTCs, and other cells usually observed in the blood from patients with cancer, such as giant macrophages and circulating tumor microglobuli, or CTM. The field of liquid biopsy began with the analysis of CTCs in the early 2000s. In the beginning, molecular techniques were developed to detect these cells in the blood. However, it has since become clear that CTCs initially require a psychopathology analysis to be detected without false positive and negative results. Cancer is an important cause of mortality, especially when detected in late stages. Even with all of the advances that have been made in its treatment, cancer is still challenging, and many patients do not respond well to any therapy. Many health agencies have considered early diagnosis as a feasible tool. In this context, it is of the utmost importance to know the morphology and characteristics of CTCs to determine a correct diagnosis. This book is well suited for physicians, biologists, biomedics, and professionals working in laboratories, hospitals, and research centers. Next, please. Ethical Challenges in Cancer Diagnosis and Therapy presents in detail the problems and ethical challenges in daily oncological practice. The title considers the ethical considerations at various stages of disease. In Western industrialized countries, roughly 25% of all citizens still die from cancer, and a cancer diagnosis has lost none of its dread despite medical advancement. Ethical questions include the benefits and risks of prevention programs, clinical trials with cancer patients, and quality assurance for surgery. Radiotherapy and medication also pose a series of ethical dilemmas. Cancer treatment is a psychological challenge not only for the patients, but also for physicians and caregivers. The issue of adequate pain management and even the question of assisted suicide at the end of life must be considered. In order to reflect on the subject's diverse and multifaceted nature, the book incorporates legal, ethnographic, historical, and literary perspectives as well. All right, and then we're going to pivot into ophthalmology. The optic nerve head in Health and Disease is a photo and illustration filled atlas that provides a detailed description in color format of the optic nerve head changes that occur in glaucoma. It explains the normal and variant anatomy of an optic nerve head and why certain discs are more or less likely to develop glaucomatous changes. Further, it explains the anatomical basis of common and not so common signs seen in optic nerve head and retinal nerve fiber layer as captured by a digital fundus imaging system and optical coherence tomography. It also includes optic nerve head conditions and mimicking glaucoma. The book is highly relevant for practicing ophthalmologists, vision science researchers, clinical optometrists, postgraduate residents in ophthalmology, subspecialty fellows, as well as general ophthalmologists, neurologists, and neurosurgeons. Essentials of Pediatric Cataract Surgery highlights various pediatric cataract surgeries. It covers variants of pediatric cataract along with other rare morphologies and challenging clinical situations along with surgical management steps. Additionally, it includes the management of surgical complications. The concise text is supported by clinical pictures and videos taken over 2 decades. Videos and voiceover are key features. This is a good candidate for digital distribution. Chapters also cover all recent advances in the field, including ultrasound, biomicroscopy, and interoperative Rexis assistant. The book is relevant for practicing ophthalmologists and ophthalmology students alike. And then artificial intelligence in ophthalmology, perks, perils, and pitfalls helps to explore the vast expanse of artificial intelligence-based scientific content that has been published in the last few years. Ophthalmology has recently undergone a silent digital revolution with medicine, learning, and deep learning algorithms consistently outperforming human graders in studies published across the globe. This book simplifies the complex mechanics of algorithms used in ophthalmology and vision science applications. It features uniform chapter design with simplified diagrams and tables to highlight important points. Additionally, it addresses potential ethical issues and with machines entering our clinics and patients' lives. This is essential reading for ophthalmologists and eye care professionals interested in artificial intelligence and digital medicine.
Okay, and for titles in orthopedics and otorhinolaryngology, our first book is Specific Sports-Related Injuries. This one is endorsed by the International Society. This book is endorsed by the International Society of Arthroscopy, Knee Surgery, and Orthopedic Sports Medicine. It is a valuable guide for decision-making to establish the best strategies to prevent and manage injuries. All chapters share a consistent format, starting with a brief presentation of the sport and its history, and then discussing its dynamics, physical demands on the athlete, common sports-related injuries, biomechanics of those injuries, and first aid on the field and injury prevention. There are 3 additional new chapters that present special aspects related to sports injuries, including mental health concerns in athletes, radiological assessment, and patient-reported outcomes tailored to each sport medicine. This book is a valuable resource for orthopedists, sports physicians, as well as physiotherapists practicing in the field of sports-related injuries. And the next title is Diagnosis in Otorhinolaryngology, an illustrated guide. This is a revised and expanded edition of a very successful book. It provides a comprehensive and up-to-date pictorial overview of the majority of ENT conditions and enables readers to understand the pathology and to find the correct diagnosis. It includes over 200 photographs and drawings and is accompanied by electronic supplementary materials presenting all the illustrations for teaching purposes. The author of the book, T. Metain Onerchi, is a key opinion leader. He holds important positions in a range of medical societies, including General Secretary of the International Rhinologic Society, and he is also the chairperson of the Rhinology and Allergy, Sleep, and Facial Plastic Surgery Committee. And for our titles in pediatric medicine, and pathology, the first book is Pediatric Head and Neck Textbook. This book provides a central background to various head and neck diseases that are common and unique to children by highlighting key diagnostics, clinical, and pathologic features. It covers a comprehensive spectrum of pediatric head and neck diseases that are either congenital or acquired. Written by an international authorship, including surgeons, pathologists, and radiologists, this book provides a concise resource for both surgeons and pathologists, especially helpful for those who do not work in specialized pediatric centers. And the next title, over to Victoria.
Yeah, so this book is Pediatric Sleep Medicine, and it provides a comprehensive coverage of all aspects related to pediatric sleep and its associated disorders. It addresses the ontogeny and maturational aspects of physiological sleep and circadian rhythms, as well as the effects of sleep on the various organ systems as a function of development. The book is split into 9 sections and explores topics such as normative sleep, the developmental aspects of sleep, methods for diagnosis, techniques in sleep measurement, and finally explores the presence of sleep issues and other disorders such as Down syndrome, obesity, and asthma. Written by recognized leaders in the field, Pediatric Sleep Medicine facilitates an extensive learning experience for practicing physicians who encounter specific sleep-related issues in their practice and fills an immediate void in the literature for a pediatric sleep medicine. And now titles in radiology. Image-guided management offers a detailed and up-to-date overview of image-guided diagnostics in COVID-19 lung disease. A range of image-guided CT and ultrasound procedures in different chest regions are described. Lung ultrasound image guidance assesses this rapidly evolving disease in real time, while CT scans may be precisely targeted. The editor provides his over 50-year experience of multidisciplinary chest imaging, including battlefield experience, to optimally combat this recent viral assault. This book will be a valuable guide and reference not only to radiologists and pulmonary practitioners, but also for imaging technicians and first responders. Choosing the correct radiologic test will enable practicing physicians and trainees to learn in a clinically relevant and intellectually stimulating way, and guidelines for appropriate ordering of imaging exams. The new edition provides more than 460 clinical case scenarios organized into subspecialty modules such as breast, cardiac, thoracic, gastrointestinal, urologic, women's, pediatric, vascular, musculoskeletal, and neurologic imaging. Each scenario is presented as a quiz in which the reader is invited to select the best option from various imaging modalities. It will be an ideal tool both for self-study and for quantitative evaluation of students' knowledge. Interventional radiology and palliative care fills a gap in the literature by focusing specifically on the role of interventional radiology in patients receiving palliative medicine and supportive care, a group in which the need for minimally invasive therapy is especially high. Detailed information and guidance is provided on use of the tools of interventional radiology for the purpose of problem solving in relation to a wide variety of diseases and complications. Readers will find clear explanations of the ways in which interventional radiology techniques can assist with regards to intravenous access, beating, musculoskeletal and neurological pain relief, tumor debulking, management of bleeding and obstructions, drainages, and treatment of fistulas. Beyond specialists and trainees in interventional radiology, it will have a broad appeal to all who deal with patients on palliative and supportive care on a day-to-day basis. Now in an updated and extended 3rd edition, diffusion-weighted MR imaging of the brain, head and neck, and spine is a richly illustrated book that systematically covers the use of diffusion-weighted, or DW, MR imaging in all major areas of neuroradiology. Since the early descriptions by Li Bihan and colleagues of the ability to image and measure the micro-movement of water molecules in the brain, Diffusion imaging and its derivatives have contributed ever more significantly to the evaluation of multiple disease processes. In comprehensively describing the state of the art in the field, this book will be of high value not only for those who deal routinely with neuro-MR imaging, but also for readers who wish to establish a sound basis for understanding diffusion images in the hopes of extending these principles into more exotic areas of neuroimaging.
All right, we're moving into rheumatology and surgery. Ultrasound in Rheumatology, a practical guide for diagnosis, is a manual to the utilization of ultrasound in rheumatology. Each chapter includes high-quality diagrams of each anatomical region, accompanied by an ideal scan with written and pictorial demonstrations, as well as an ideal ultrasound image. The systematic approach to describing the application of ultrasound enables the reader to develop a deep understanding of how to correctly make use of the technology in their daily practice. This is a valuable resource for both trainees and practicing rheumatologists. Lower Gastrointestinal Tract Surgery Volume 2 Open Procedures is a new atlas containing a wealth of clear operative images that enables trainee surgeons to visualize the surgical field for procedures specific to open colorectal surgery. You'll see a reference to Volume 1 on laparoscopic procedures on the slide. Here in Volume 2, step-by-step guidance is provided for a wide range of procedures to the colon, rectum, pelvic floor, anus, and anal canal, in each case paying meticulous attention to surgical anatomy. The full range of potential indications for open surgery is considered, including benign and malignant tumors, inflammatory bowel disease, and appendicitis, among others. Whenever considered necessary, additional line drawings are included to aid comprehension of particular steps. Readers seeking to improve their understanding of surgical anatomy and how to perform these operative procedures will find this atlas to be an unparalleled resource. Emergency General Surgery in Geriatrics responds to the growing need for a book on emergency general surgery in the elderly, as adults aged 65 and older are the fastest growing segment of the world's population, which is expected to double to 89 million between now and 2050. Based on these changing demographics, it is expected that there will be a concurrent rise in the demand for a variety of surgical services, including vascular surgery, which has a projected growth of 31%, and general surgery with a projected growth of 18%, as well as in subdisciplines of surgery. In addition, older surgical patients often require a different level of care than younger patients during the preoperative and intraoperative and postoperative phases. This book offers surgeons, generalists, and nurses state-of-the-art surgical approaches and essential information on the complex perioperative care of the elderly. Prophylactic surgery introduces the most important standards and principles of prophylactic surgery, which are surgeries intended to prevent the development of cancer. As a foundation, it addresses the comparative effectiveness of screening in the treatment of hereditary cancer syndromes and evaluating genetic predisposition. The book then moves to address ethical, legal, and social and cost-effectiveness dimensions of prophylactic surgery. With the aim of preventing hereditary predisposition syndromes, it includes a chapter on the application of preventative surgery to all specific fields of surgery. Given its scope, the book will appeal to a broad readership from experienced surgeons to students.
And we have two titles in the non-clinical highlights from Springer. And the first one is Tenacity in Children. For parents faced with the challenges on how to best prepare their children for a different school experience, or children who need help to cope with the stress, anxiety, or changes in learning, Tenacity in Children is a timely resource for parents to support their children's growth and education at home. It offers a new way to understand the processes by which parents help children thrive, strive, and survive. It introduces tenacity as a guiding concept in parenting and preparing children for lifelong happiness and success by examining how 7 genetic traits intertwine and can be leveraged to help prepare children for lifelong success. So the key areas of coverage include the the 7 instincts of intuitive optimism, intrinsic motivation, compassionate empathy, simultaneous intelligence, genuine altruism, ethical responsibility, and measured fairness. And it also includes practical strategies to guide children in acquiring and fine-tuning these essential human instincts. So the next title we have on the slide is Shared Struggles. We like to call it a support group in a book. This shared struggle shares true and poignant anecdotal stories from both sides of the physician and patient relationship. It offers perspective and insights into the dynamics and challenges between parents of medically complex children and the medical expert. The stories are grouped in 4 sections: hope, compassion, communication, and trust. And each section includes stories contributed by parents all across the United States and by pediatricians practicing at many of the best children's hospitals. This book is edited by the author Barry P. Markowitz from the Children's Hospital of Los Angeles, and by Anne F. Schruten, who is the parent of a child born with a chronic complex condition. So this is a very important topic. There's no other book out there like it, and From Springer has a really nice academic and yet medical weight to it behind it. So these are our Q2 non-clinical highlights. And thank you everyone for joining.
Thank you so much for joining the presentation today. Please don't hesitate to reach out to any of us with questions or comments or your rep. Thanks.